welcome to the show. Our guest today is Jordan with Missoula Medical Aid. Jordan, a lot of people probably don't know what Missoula Medical Aid is, so let's start with, what do you guys do?
Sure. So Missoula Medical Aid is a nonprofit. We're based out of Missoula, but we have volunteers all over Missoula, Montana, and the U.S. We began in 1998. We responded to a disaster in Honduras that a group of nurses here in Missoula heard about. Hurricane Mitch devastated large areas of rural Honduras. It basically hovered over Honduras for a week and devastated villages, farmland, left tens of thousands dead, missing. And a group of nurses here in town who worked for an organization that didn't have a lot of patients at the time decided to raid the supply closet. Their boss agreed, and they traveled to Honduras to help. So they got off the plane, set up first aid stations, basically did disaster relief, and for a good week. And when that group came back, another group wanted to go. We basically started because of a group of people who wanted to help in another area, and that we had resources with which we could provide that help. So we had supplies, and we had profession in the medical field of people that wanted to go. We also took some builders, folks who helped to rebuild schoolhouses and hospitals. That was how we began. Within the first year, 3 or 4 trips went, and they saw that there was a need for healthcare that was beyond disaster relief, that these rural communities in Honduras don't have much access to healthcare. And that's where our short-term medical brigades were born. And so we partnered right away with an international group called Save the Children and asked them to host us. We basically said, hey, if people still want to come down and help out, and we can bring supplies and medicines, can you help us? Can you put us in places that have the needs? Mm-hmm. And they said yes. So we've been doing that now for 20 full years. We've sent 1, 2, 3, 4 trips a year to do primary care. It's basically a well child clinic, but we see all ages. And check in with folks and give them some vitamins and give them some ibuprofen for the next backache. It's been a wonderful experience. And now we're looking directly at the needs of the Hondurans due to COVID, which is hunger. Okay. A lot of the shutdowns that have occurred in Honduras means that people can't work. And when people can't work, they don't have money and they can't eat. And the areas that we've served primarily are really quite poverty stricken. So we're talking about people who are poor becoming poorer. And that directly relates in lack of food. And so we've really, we had a trip planned in April. We had our bags packed. We had medicines, we had supplies, we had people who'd volunteered and fundraised for their trip, and we were ready to go. And we canceled. We have since donated a lot of those medicines and supplies locally. And our shift now is directly to supplying Save the Children with funding so that they can purchase food and give it to people who need it, and so that they can support agriculture programs that are in the areas that we serve. And so our shift has changed, and we're looking at how we can help on the ground right now with literally handing out food. Our most recent campaign was to help hand out 600 bags filled with 2 weeks worth of dried goods, rice, beans, sugar, cornmeal, to families in need. And that was a success. Save the Children was able to get out into the communities once they were able to get agricultural passes to actually travel on the roads. They were able to go to the communities and pass these bags out. And so we're currently looking at ways that we can fundraise into the fall to again help supply the very direct needs that have to do with food security. That's our goal for the near future.
Okay. So a really quick pivot based on COVID-19 showing up on the scene. Yeah. Needs still there, it's just a little different how you respond to it. I had a question that came and went. What's your website? Just since we don't have the ability to put on titles on the bottom particularly, what is your website?
Sure, it's MissoulaMedicalAid.org.
Okay. And so if people are wanting to help out on this, they can, I'm sure, donate on your website. Is that correct?
Yep, directly on the homepage, there's a donate button.
Okay. Well, they're interesting changing times, and so I'm glad that you're adapting to it well and still helping the world out. Anything else that that's significant as far as these changing times?
Boy, no, just that, we know that there is, this is a difficult time for everyone and for a lot of communities, and that our goal at this point simply is to help funnel resources in terms of funding currently to purchase food. We don't have an abundance of resources here, but we certainly have more than they do. And so Missoula Medical Aid will be here for as long as the goodwill that comes our way, as long as we're able to funnel that efficiently and effectively to areas of need in Honduras through our partners that we have there on the ground. That's our hope to continue. And that's what we're looking forward to doing. So, in the next year or two, we're definitely going to be responding to the COVID crisis in that way, with food security as the forefront. And then we're hoping to move again toward, if not only medical, helping those who are the most poverty-stricken rise up and come into the fold of their communities in a way that allows them to provide more food on their farm so that they can sell in the next town over and have some income. We want to help those with lesser resources than we have. And we'll continue to do that as long as the goodwill is here, which is still coming. We're just amazed and honored and blessed that Missoulians and Montanans and others around the U.S. want to continue to support this effort in Honduras.
Great. Well, thank you for all the hard work that you're doing, and thank you for coming on the show today. It's great to learn a little bit more about what you guys do.
Thank you for having us.